नमस्कार एव्हरीवन. आज या वर्षीचा उत्तरंगचा पहिला कार्यक्रम आहे. सगळ्यांचं खूप खूप स्वागत. माझं नाव प्रीती फडके. मी यावर्षी ईसी कमिटीवर उत्तरंग डिरेक्टर म्हणून काम करते. मी 3 वर्षापूर्वी आम्ही ऍक्च्युली कॅलिफोर्नियाहून इथे शिफ्ट झालो, तेव्हा कमिटी जॉईन केली नवीन ओळखी व्हाव्यात वगैरे म्हणून. सो आय एम रिअली एक्सायटेड. यावर्षी आय नो चा पहिला कार्यक्रम डॉक्टर विभाकरांचा आहे. थोड्याच वेळात मी त्यांचं इंट्रोडक्शन करीन, पण बिफोर दॅट सिन्स आय थिंक बरेच जण म्हणजे आम्ही सगळे म्हणजे नवीन आहोत, सो जस्ट वॉन्टेड टू टेक दिस ऑपॉर्च्युनिटी टू इंट्रोड्यूस. I think I'll hand it off to Neelam. Neelam is helping me as the Uttarang coordinator. So Neelam, you want to do a quick intro?
नमस्कार मंडळी, मी नीलम सोरटे. मी उत्तरंग कोऑर्डिनेटर म्हणून यावर्षी EC3 वरती काम करते. सो हा पहिलाच कार्यक्रम आहे जिथे आपण ऍक्च्युअली झूम वरती पण 1-on-1 एकमेकांना बघतोय आणि भेटतोय. तर फार आनंद होतोय. तुमच्यासाठी असेच नवीन नवीन कार्यक्रम घेऊन येण्याचा आम्ही प्रयत्न करतोय. सो तुमची अशीच आम्हाला साथ मिळो. आणि आता मी माधवी, MKM प्रेसिडेंट माधवी आगाशे यांना हँड ओव्हर करते. माधवी.
थँक्यू नीलम. नमस्कार, गुड मॉर्निंग आणि होप यू आर हॅव्हिंग अ गुड सॅटर्डे. सो वर्षाच्या सुरुवातीला नीलम आणि प्रीतीने एक सर्वे पाठवला. तुमच्यापैकी बऱ्याच जणांनी त्या सर्वेला रिस्पॉन्ड पण केलं. तर तो सर्वे घेऊन यावर्षी आम्ही ट्राय करतोय की जितकं जमेल तितकं तुम्हाला जे हवंय, तुम्हाला जे बघायचं ऐकायचंय तसे कार्यक्रम घेऊन येण्याचा ट्राय करतोय. आणि नीलम आणि प्रीती अगदी म्हणजे जरी मला सुरुवातीला वाटत होतं की ओके उत्तरंगला ह्या दोघींना कसं अप्रोच करायचं, पण मला वाटतं त्यांना खूप आवडतं हे काम करायला. आणि तुमच्या फीडबॅकमुळे खूप इझी जात आहे थोडं डिसाईड करायला की काय आपण ठेवणार आहोत, काय कार्यक्रम करणार आहोत. आणि लाईक वी सेड, दिस इज जस्ट द फर्स्ट प्रोग्राम. सो थँक्यू नीलम, थँक्यू प्रीती. आणि आपल्या कॉलवरती 2 अजून आपल्या ईसीचे लोक आहेत. एक म्हणजे ऋषिकेश चव्हाण, तो आपल्याला टेक लीड म्हणून हेल्प करतोय, म्हणजे जर काही मदत लागली काही झालं तर तो अवेलेबल आहे. आणि आपली वेबमास्टर आहे संगीता करंबेळकर, ती आपल्या बरोबर स्लाइड शेअर वगैरे करणार आहे. सो अशी आमची ही 4 जणांची टीम आज we are going to work this event. So back over to you Preeti, आणि maybe थोडेसे rules, housekeeping rules प्रीती तुम्हाला सांगेल.
सो डॉक्टर विभाकरांना हा प्रोग्राम इंटरॅक्टिव्ह ठेवायचा होता. सो तुम्हाला केव्हाही ते बोलताना काही प्रश्न असले काही असले तर प्लीज डोंट हेजिटेट टू आस्क, अगदी विचारा. मी रिक्वेस्ट करते की सगळे ऍटलीस्ट कॉल क्लॅरिटीसाठी आत्ता म्यूटवर राहा आणि व्हिडिओ ऑफ ठेवा. जर काही प्रश्न असेल तर तुम्ही चॅटमध्ये झूमच्या ह्याच्यात एक रिॲक्शन्स मध्ये तुम्ही क्लिक केलं तर रेज हँड येतं, तर तुम्ही तसं हात वर करून म्हणजे आमचं अटेन्शन घेऊ शकता, किंवा चॅटमध्ये टाईप पण करू शकता की एखादा प्रश्न असेल वगैरे. तर मग वी विल ट्राय टू गो अराउंड गिव्हिंग एव्हरीबडी अ चान्स टू आस्क. पण एवढंच सांगायचं होतं थोडंसं विभाकरांबद्दल. सो डॉक्टर करंबेळकर हे ही इज अ डॉक्टर ऑफ फिजिओथेरपी. ते गेले 30 वर्ष प्रॅक्टिस करतायत. इथे ॲनंडेल मध्ये त्यांची प्रॅक्टिस आहे. ही गॉट अ डिग्री फ्रॉम युटिका कॉलेज इन न्यूयॉर्क. आणि त्यांची बरीच म्हणजे वर्षांची एक्सपिरियन्स ऍक्च्युली has been in treating orthopedic, neurological diagnosis related conditions. So I think this talk, I hope you find it useful. So with that, I will hand it over to Dr. Vibhakar, who can take it over.
Namaskar and good morning everyone. And thank you Nilima, thank you Preeti, and thank you Madhavi for a nice program and good introduction. I hope you can hear me well. So today we are going to talk about falls, risk and prevention in older adults. So it's a topic not intended to cause any alarm, but just to put on your radar and to make you aware of the risk involved in something many a times we consider very trivial as a fall. And then there are ways of really prevention, although in medical community, we do not use the word prevention very often because we cannot really prevent anything. You only manage the risk. So we are going to talk about this big risk, which is called the fall. So next slide, please. So by definition, fall is an unintentional change of position where a person comes to rest on either the ground or any lower level from his original position of standing or whatever the position was. So this is a very interesting definition because it will include many situations that you do not consider as a fall. So for example, if you stand up from the bed and just fall back down in a sitting position, by definition, it is a fall. And for example, if someone is sitting on the toilet and they drop down a couple of inches uncontrollably because the toilet was too low, so that also by definition is a fall. And the reason why they have included these as falls, because when someone has osteoporosis, even that much of an impact of landing heavily on a toilet can cause a hip fracture. So when you talk about the risk of fall, each older adult every year has 33% chance. So 1 in 3 older adults fall every year. And this is just the United States. So we are very much at risk of a fall. And by definition, older adults are classified as people 65 and over. Next slide. So what does a fall do to us? So we cherish our independence, and that's exactly what it robs us. It is a big threat to our health, to our independence. It reduces your ability to be independent, and there are many ways that you can manage that risk, as well as it is very important to remember that you cannot say that, oh, I'm getting older. At this age, what do you expect? I'm going to fall. But that's not inevitable with age. You can live all the way into the 90s and not experience a fall. There are many people I have seen who actually do that and take steps to do that. So next slide. So the statistics, if you look at, these are the numbers from CMS, Centers of Medicare and Medicaid Services, as well as the CDC, the Centers of Disease Control. And this is only for the US. So every second of the day, an older adult is falling. Every 18 seconds, they require emergency care or a visit to the emergency room. And every 35 minutes, there is a death from that emergency visit. So it is considered that there are 3 major causes of death in older adults. The number 1 being cancer, number 2 being a cardiac event, and number 3 is injury. So falls top the list of injuries as the number 1 cause of injury death in older adults. You will find it familiar that many people, when they have a fall, they say, okay, I will try to limit going outside, because they think that if they don't go out as much, then they may not fall and they'll be safer. But unfortunately, 60% of fatal fall occur in the home itself. So if you are thinking that if I don't go out or limit my outside activities, then I might be safer, that is not the case. In fact, there will be functional decline and your risk increases. In our country, women tend to live longer and outlive men. So most women by age 90, they have suffered a hip fracture from a fall. So these are some of the things that really make this a huge issue for anybody with 65 and over. Next slide. So when you consider fall as injurious, there are two types of injuries that happen very often. Number one is hip fracture, and number two is traumatic brain injury. So hip fractures we are very familiar with because a lot of people around us experience hip fractures, and most of them are from falling down. And something that we need to really pay attention to is a traumatic brain injury, because we and most people think that if they have fallen and if they have not hit their head and if they did not have any visible injury to the head, there is no need to go to a doctor or get emergency care or get a CT scan done. But as we get older, our brain volume declines, it shrinks. So there is more room between the brain and the skull for the brain to really rattle. And as we age, our blood vessels are also getting stiffer. So the small blood vessels, which are stiff inside of our brain and skull, even a slightest tap or a jarring movement can trigger a intracranial bleed. So if you remember, like a few years ago, there was a news of a very healthy person, Dr. Robert Atkins, who was the proponent of the Atkins diet in Manhattan, in New York. He had a very minor slip and fall in front of his own office, where he slid on ice and fell down. And he had a very minor head injury. He hit his head on the ground and he died from it. So head injury or hip fracture alone cause 800,000 hospitalizations in a year in US. Please go to the next slide. So when people fall, one of the major things that happen to them is they develop a fear of falling. So that fear of falling by itself is a risk factor. So if you are afraid, so you alter your gait, you alter how you do things, and then you tend to hold on to the furniture as you walk around, and you get used to that. So then suddenly when you are in a situation where there is nothing to hold, then person falls. As we know that, as we heard before, 1 of 3 people fall each year. As the age advances at 72 plus, a fall can happen every 2 years. And at age 80 plus, it can happen every year. Go to the next slide. So if you have any questions along the way, just feel free to ask, okay? Because at the end, you may not even sometimes have the time or recall the questions. So in our country, if you are aware, we have two major medical insurances. One is Medicare and the other one is Medicaid. And they are managed by one federal agency called the Center of Medicare and Medicaid Services. So they have mandated all providers to collect data on falls. And then they gather that data and determine the fall risk, and they see how the falls are impacting the population's health as well as their bottom line. So we are required to collect data in terms of when was the last fall. So your doctor might ask you, did you fall in the last 1 year, or did you fall within the last 6 months? So if that is the case, then you're considered as a high risk individual. And then Medicare requires them to refer the person for a falls prevention program. So what does a falls prevention program do? So it will potentially reduce injuries, reduce ER visits, reduce hospitalizations and eventual nursing home placements, and it will improve the health of the community by reducing functional decline. So ultimately, this is a huge and major expense for the insurances. So they recommend this referral to be made, but it's not being really followed because many a times people who come to us and request that they want to walk better, they don't want to fall, they want to improve their balance. Most of these people are self-referred. I have never come across, or very rarely come across, a prescription from a doctor saying physical therapy for fall prevention. So that rarely happens. Only in managed programs, there are interventions directed to community dwelling older adults, where the nurse goes into the home, physical therapist goes into the home, and then determine the fall risk and home safety, and then a fall prevention program is implemented within the home. So some private insurances or some Medicaid and Medicare programs do that, but if you are a community residing adult and you don't fall into any of those categories, then your physician may not exactly tell you to go and get that done for yourself. Next slide. Next slide, please. Sangeeta, so just when I'm towards the end of the slide, just go on to the next slide.
Kelly.
So when we talk about the risk of falls, there are two kinds of risk factors. Some are modifiable and some are unmodifiable. So for example, poor vision. So you have to make sure that you have your annual eye exam, make sure that your prescriptions are current, and if you have any conditions of the eye, they are properly addressed. Leg muscle weakness. So as we get older, it is very important to do strengthening exercises, walking, and resistance exercises, and make sure that you do not lose the muscle mass in the legs and strength in the legs. Your thigh muscles, they are very notorious because if you do not exercise for 2 weeks, you will have a significant decline in the thigh muscle strength. Then poor balance. So with loss of muscle strength, there is also decline in balance. Fear of falling. So how do you manage this risk is not to fall in the first place. So, and then the fear of falling also comes when you're walking unsafely. That means if you need a cane, you should walk with a cane. Difficulty in walking. So there are various diseases, conditions of the leg or weakness, and all of the above factors impair your ambulation. So when the ambulation is impaired, a lot of things happen, and then that faulty way of walking can itself add to the risk. And then polypharmacy. That means if you are taking more than 4 medications a day, it is in itself considered as a risk of fall. So we are going to talk about some of these modifiable and unmodifiable factors in detail. And the last thing is on this slide is dizziness, vestibular deficits, and postural hypotension. The postural hypotension is a cardiac condition where there is a drop in blood pressure. The dizziness could have various causes. It could be either lightheadedness from postural hypotension, or it could be from a vestibular decline as we age. In our inner ears, we have a system called the vestibular system, which is very important, and it plays a major role in balance. So that system progressively loses its efficacy. The more you challenge it, the better it is. The less you challenge it, it loses its ability to maintain your balance. So based on your activity level, if your activity level is declining, then your balance automatically declines. This is called age-related vestibular loss. So if there is an asymmetry in that decline, that means one side of your ear vestibular system is functioning at a higher level than the other, then you will have dizziness. So there are ways and exercises to take care of that. And then the dizziness has to be also differentiated from vertigo. In dizziness, you feel your head is spinning, but in vertigo, you will realize and you will feel as if the room is spinning. So if you have vertigo, then that is an acute condition and that needs to be properly addressed because there are maneuvers to put back the crystal in place that has dislodged in the vestibular system, causing vertigo. So then the other factors are foot and shoe problems. So if your shoe is losing shape, then it's time to replace. If you're losing strength in the muscles, then you are also losing strength in your feet, the intrinsic foot muscles. So we exercise mostly our arms and our legs. In legs, we exercise our hips and our knees, but nobody pays attention to the feet. So the foot could assume various shapes. You can develop high arches, flattened arches, bunions, or hammer toes, and all of those things will reduce or affect your weight bearing surface, and that's what we stand on. So you have to really pay attention to the foot, make sure it is flexible and strong to adapt so that it can keep your balance. So when we maintain our balance, the foot plays a major part in adapting to the surface you are standing on, and then all the other factors come in to maintain your balance. But foot is where you are contacting the ground, so that is very important and not to be neglected. Then home hazards. It is considered that home is one of the most hazardous places that we could be in when it comes to the day-to-day functioning of an older adult. And we are going to talk about that more in details about the hazards in the home. Lack of safety equipment. So many times we have our parents or our own selves in the house with difficulties and balance issues and weakness or some conditions. But then we are in a state of denial and then we try to hold on to our independence and then we do not go for any safety equipment. So if you just add some simple stuff in the home and make some small changes, it can really go a long way. Incontinence is also one of the modifiable risk factors. One of the major problems of incontinence is there is urgency, frequency, or hesitancy while passing urine. And then if any of these are present and if there is incontinence, then frequent trips to the bathroom could add the risk of falls. Then low weight and frail older adults. So after the age of 65, it is not recommended that you make attempts to lose weight the traditional way, because when you try to lose weight and if it involves eating healthy, maybe you don't have the appetite to eat enough protein. So you have to definitely concentrate on higher protein. And then you have to also eat more nutrition dense foods. So that will give you more nutrition in a lesser volume. But if you lose weight, not only you have to take care that you not only lose the fat weight, but by accident you should not lose the lean body weight, which is the bone and the muscle. And that's what happens most of the times in older people. So your diet has to be high in protein, nutrition dense in small portions, and at the same time, make sure that you do weight training and exercises that involves resistance, and do not really try to lose too much weight because it's a spiral downwards. And then some of the people in their 80s have seen that they are in a state which is called failure to thrive. So that means they have been losing weight constantly without any apparent reason, and nothing that you do can stop it. And then depression. So nothing much to say here because it's a psychological condition and could lead to functional decline. The unmodifiable factors, which we really can't do much about, you may be able to influence them in some way, but not completely. So that is number one is age. So with advancing age, as we saw earlier, the risk of falls is going to climb. And the previous history of fall, that's where the fear of fall ties in. Women more than men. Again, as I said, like women outlive men, so they are more potentially at a higher risk, as well as they suffer more from osteoporosis. So that again is something that puts them at higher levels of injury as compared to men when they fall. Then poor sensation in feet and legs, that is because of peripheral neuropathy, cognitive impairment, we are going to talk a little bit about that, and other chronic diseases. So these things we can't do much about. Medications and falls. We mentioned earlier that polypharmacy, if you're taking more than 4 medications, you need to talk to the doctor. We always educate ourselves on the effects of the medicines and the side effects. But there is another thing that we have to also focus on, which is called adverse drug reactions or drug interactions. So there are ways that your doctor can find out if giving you a certain combination of medication will produce adverse drug reactions or how they will interact with each other, because that will increase fall risk and then other medical problems. You need to always check that. And then also have a conversation regarding the lowest possible dose, because many medications, which are like cardiovascular medicines or antipsychotic medicines, they inherently increase your fall risk. Cognitive impairment. So that was one of the factors we mentioned as a modifiable factors. So in cognitive impairment, there is usually short-term memory deficit, problems with abstract thinking, attention deficit, and difficulties of processing information. So in your family member, you have to be the one to recognize the signs in the other, because they may not realize it or they may completely miss it. And if the person in question is of high intelligence, they can certainly mask cognitive impairment very well until it is a bit too late. So what are the signs you look for? So missing appointments or important events, that means forgetfulness, decision-making difficulties. For example, they are having difficulties in tasks that they were able to do before easily, like financial decisions or balancing a checkbook, forgetting words or sentences, forgetting conversations, and cannot process difficult instructions, and even getting lost in your own town. So many of these things and most of these things happen to us anyway. But if it is so severe that it is impairing your day-to-day function, if it is impacting your day-to-day function on a regular basis, then it needs a neurological workup. So that has to be paid attention. So the risk of cognitive impairment in terms of fall is that people with cognitive impairment, they often will have poor judgment, and that comes in the way of their safety and lack of safety awareness. So that is where they end up falling. So when you do a MD consult or a neurological consult, what they will do is they will look for any reversible causes of cognitive impairment. And then they might end up giving you a referral for occupational therapy. So what does the occupational therapist do? They would first assess you clinically. They'll see if there are any difficulties in ADL, that is activities of daily living. Because a person with cognitive deficit eventually starts forgetting even simple tasks and how to do them. So they will have difficulty putting on clothes. They will have difficulty matching clothes the way they used to before. They will have difficulty with personal hygiene. So this happens so slowly that you consider it as part of aging. So the occupational therapist will be able to pick up on that and then do some mental and memory function tests. So like for example, MMSE, which is a mini mental state examination, and then a very simple thing called the clock draw test. So when you ask someone to draw a clock, you tell them, take a piece of paper, give them a piece of paper and pen and tell them, okay, draw a face of clock with numbers and with hands, the hour, minute and second hand, and show a certain time. For example, you tell them draw 10 past 10. You will be amazed. People who are talking to you absolutely normally, people who are functioning absolutely normally, but they might have a little memory deficit here and there, they will not be able to draw a clock correctly. So that's a good test to do on people in your home if you suspect that there is some issue with cognition. Then the other test, can you go back one slide? And the other test is 3-word recall. So you can tell the person 3 random words, and after a few minutes ask them what were the words. And if they are able to recall, then it's good. Otherwise, if they cannot, then you definitely need a neurological consult. So the occupational therapist will work on education of the caregiver, activities of daily living and cognitive skills. So
I think mute करायला लागणार आहे का कोणाला तरी? बघते मी.
Yeah, I got muted for some reason. So incontinence. So that was one of the modifiable factors we talked about that contributes to a fall. The risk being that the falls can happen when they are rushing to the bathroom or rushing to transfer to the commode because of either the urgency or incontinence or any of the things that happen along with that. So the medical doctor will assess the bladder and bowel function. They will try to see how it can be controlled by setting up a voiding schedule, and as well as trying to manage the fluid intake in a proper way without cutting down on the fluid intake, and also determine if the incontinence is because of stress incontinence. That means weakness of the pelvic floor muscles or weakness of the abdominal muscle. So if that is the case, then there are definite physical therapy interventions that could be done, very simple exercises and techniques to prevent and actually improve the symptoms of stress incontinence. In an older adult, the other thing that you have to really monitor very closely, like for example, you are living with your parents and everything is fine, and then suddenly one day you see that they are slightly confused. So that could be a sign of urinary tract infection, because in older adults, UTI, which is frequently associated with incontinence, the person may have incontinence and then they could develop like recurrent UTI. So the UTI may not present as pain or burning while passing urine or any other discomfort. They will just be out of it, or they will just appear confused. They may not even have a fever or anything. So if you see confusion in elderly, most common suspicion should be UTI, because if that is treated in time, it stops many of the major medical issues that happen later. So that treatment of infection, if any, also will make sure that they do not fall, because in that confused state, they can sustain fall. Postural hypotension was also one of the modifiable factors. The risk here is that with position change, there is a 20 mm drop in blood pressure. So when that kind of a drop is diagnosed, there is an immediate blood loss to the brain, and the person could get a syncopal attack and just collapse to the ground. So again, the exercises before you get up, like ankle pumps, hand clenching, use of pressure stockings, and adjusting the dose of medications will prevent and will help the condition as well as help to control the falls. Because while you have a certain condition, you don't want to fall because of that. Next slide. We also talked about another risk factor, which was changes in the musculoskeletal system as a person ages. So what happens in the musculoskeletal system is that there is loss of muscle mass in elderly. And because of the loss of muscle mass, there is decline in muscle strength, muscle tone, decline in endurance and agility or mobility. Every decade after the age of 60, you lose a certain percentage of your lean body weight. So you will notice that even with the same diet, even with the same routine and day-to-day activities, a seemingly healthy older person every year looks thinner and thinner, because they're losing the lean muscle mass and the bone mass. So you have to really take steps from your 50s to slow that down. Means you cannot prevent it, but you can definitely slow it down. And the only way of doing it is through a routine of weight bearing, resistance, and weight training type of exercises, and a good intake of protein in your diet. So it also, the musculoskeletal changes also are in terms of endurance and reduction in mobility, reduced elasticity of your ligaments, leading to stiffening of joints. So especially the knees, hip, spine, and ankles, and developing foot deformities. So all of these would contribute to a fall, because as I told you, when you stand, your foot is constantly trying to adapt to the ground, and then your knees follow the foot, then your hips follow the knees, and your spine is trying to balance itself on the hips. So these segments of your body, they are trying to balance themselves on top of each other. So if you have stiffening of all these joints, the range of motion available is very limited, and then the corrective strategies cannot be implemented when you lose balance because of the stiff joints. So what can a physical therapy person do with these musculoskeletal changes? So a physical therapist will assess the range of motion, strength, posture, and joint deformities. So we do document all of that, and then we provide interventions to counteract the negative effects of these. So they include exercises for your range of motion, stretching, strengthening, resistance exercises, as well as balance activities. So when all these changes are happening, it translates into abnormal walking or walking with deviations, which we call as gait deviation. So what do they amount to? So they amount to reduced walking speed, difficulty in smoothness of walking, symmetry, increased time in double stance. That means the time you spend on with both feet on the ground while walking is called the double stance. Difficulties in initiation of the gait, foot drop, decreased step length, and instability of the trunk. So I'm going to talk a little bit about can you stay on the same slide? I'm going to talk a little bit about the individual aspects here. So walking speed is considered the sixth vital sign in an older adult. So,
Vibhakar,
yes.
sorry to interrupt. There is a
No, no.
question
Yeah.
from Priya Mahata.
Okay.
What should be BMI at older age?
I will not have an answer for that at the tip of my tongue. The BMI is a good indicator, but then you should not just rely on that, because it's a overall indicator. Because see, if it will give you like ranges from who is morbidly obese versus who is obese and who has the appropriate body weight or who is underweight. But then you really need body composition to make sure that how much is water, how much is fat, and how much is muscle mass. So you need a breakdown of that BMI to really get a good idea of where you stand. So nowadays there are these specialized weighing scales available. Previously, they used to be only available in offices of people who do nutrition and weight loss kind of practices. But then you can buy one of those scales which has sensors. So you stand on them barefoot, and then you have an app on your cell phone. And based on the sensors and your skin touching the sensors, they determine and estimate your body composition. And they also give you a very good idea and a good breakdown, as well as you can print out a report. And if you are following a certain diet, or if you are working out, and then you can track your changes on your app. And they would also give you an estimate of your actual age versus your physiological age. So I would suggest that, and not just rely only on the BMI. So does that help?
Oh, yeah, definitely. Thank you very much.
So,
Doctor, just a quick time check. 11:50 झालेत. Just
okay.
yeah.
Yeah, we'll go through it in another maybe 10 minutes.
Yeah. Okay.
So one of the important things we have to remember is the walking speed. The walking speed is considered as the sixth vital sign in older adults. So as we get older, the walking speed declines. And there are studies that have said that a decline in walking speed is very, very correlated to functional decline and the risk of death. So you have to, those who are into the habit of walking, thumbs up to them, and then they should continue to do that and try to maintain your speed, because that speed comes only when you have enough strength, enough flexibility, enough balance, and any of these things declining will definitely reduce your walking speed. So even on the cell phones nowadays, in the iPhone, there is a health app. If you look into that health app, you can not only count steps, but it can also give you some estimate of your walking speed and how much time you spend on double stands, how much symmetrical gait you have, and whether you deviate from the midline too much. So all of these things are available on the health app in the Apple phones, iPhones. So it's something that you can look at and it's worthwhile. So then difficulties in initiation of gait. So people with Parkinson's, this is one of their major problems for them. Not only with Parkinson's, but if you have stiffness in the body, you get up and you expect yourself to start walking. And in many cases, our mind is faster than the body. So we think we are going, but then the body doesn't keep up. And that's when people fall. Okay, next slide, please. So what can we do about it? We have something called gait training to correct your ambulation and its deviations, exercises, balance exercises, weight bearing exercises, and assistive device training. And then it is a good idea to get a physical therapy evaluation done because that gives you a baseline. And then if you're following a routine, like maybe a year down the road, you can again go and get yourself checked and see how much progress you have made. So next slide. Balance impairment. So as the age advances, we have impairment in multiple systems of our body, the musculoskeletal, nervous, visual, vestibular, and sensory. And all of that will make your balance decline every year. Next slide. So in our balance assessment, what we do and what a physical therapist will do is like they will do balance testing. They will look at the foot, ankle, hip, and knee strategies of balance, whether they are functioning well, time you on single leg stance. They will time you on the timed up and go test, which is a evidence-based test that will give you a numerical score, 5 times sit to stand times, Romberg's test, functional reach test, and the modified clinical test of sensory interaction. So these are all standardized tests that Medicare requires that any provider should do when they assess balance, because then you can quantify and really monitor progress of the person. So then there are various balance exercises. How they are classified as static balance and dynamic balance exercises. And then the way you progress them is to start with static and progress to dynamic, start with eyes open exercises, and then progress to eyes closed exercises, and then progress the balance exercises from sitting to standing to walking. Weight bearing, weight shift, strengthening, yoga, and Tai Chi. So Tai Chi, I don't have any experience with, but there are multiple exercises that yogasans. There are multiple yogasans that people can do for higher level balance. So if your balance is good to begin with, then that's something that you should definitely do. And I'm sure a lot of you do yoga, and then I need not tell you the benefit of it. So some of the examples of static balance exercises with eyes open or closed is standing with feet together, standing weight shift, tandem standing, that means standing with one foot ahead of the other, standing on one foot, that is single leg stance, and then standing while doing some upper extremity dynamic activity, for example, reaching or throwing and catching a ball, and then standing on foam or uneven surface. So then that triggers your balance reactions just by the way of standing. Dynamic balance exercises could be heel to toe walking, side stepping, crossovers, and step overs. Next. And then we did talk about the vestibular system. There are a lot of exercises that you can do to improve your vestibular function. So these are just some of them. So you can put a small X on a post-it notepad and then hold it in front of your eyes at arm's length. Keep your eyes on target and then turn head side to side. So keeping the eyes on the target is the function of the vestibular system when your head is in motion. So you can turn head side to side, head up and down. You can do it in sitting, standing, and walking. So these really challenge your balance and engage your vestibular system. So then ankle sways and circle sways. Next. So these are some pictures of the exercises. So you want to do strengthening for the leg. Simple way of strengthening is just standing with support. So for older adults, I always advise that when you do any kind of standing exercises, you have to hold on the back of a chair. And then if you are doing any kind of balance dynamic exercises, someone has to be walking next to you for safety and not let a fall happen. And then if you're doing standing static balance exercises, you should stand in a corner, wall corner, and then have a chair in front of you. And then you don't have to lean on the wall or hold the chair, but it's just there to prevent any loss of balance. So then these are some hip exercises, like you do knee lifts, leg lift sideways, backwards. Next. Then sit to stand from a standard chair. Next. The heel raises, single leg stance. So the heel raises are one of the most important leg exercises. So research says that if there is only one exercise you have to choose for your legs, it should be the heel raises. So do that every day. And then single leg stance, that's fine. Next. And then the foam pad that I talked about, this is called the AirX mat for balance. It is a dense foam mat. So all you have to do is just stand on it and practice standing on it with minimal support, and all your balance mechanisms get engaged. Next. So this is the tandem stance where you stand with one foot ahead of the other, and this is the tandem walk when you are walking a straight line. So you should have somebody walk next to you when you do that. So to control loss of balance while doing it. Next. And this is the cross of the step side stepping exercises. Here it is shown that the person is doing with a yellow TheraBand, but you don't have to use it. You can just do side steps. This is the crossovers where you go crisscross across the room in both directions. This is the step overs where you step over obstacles. So very simple things you can do at home. The next, and then this is the person standing in the corner and doing vestibular exercises. So in addition to standing in the corner, you should also have a chair in front of you. So these exercises are to be done for 30 seconds with eyes on the target, side to side, as well as up and down. Next. So then another very good balance exercise and vestibular exercise is just walking with head turns. You will notice that when an older person is walking and you try to talk to them, they have to stop. They stop, turn their head to you, they talk, and then they walk again, because they cannot do this. Because if they do that, they will fall. So they cannot talk to you while their head is turned to one side and keep walking at the same time. So, but if you practice this, then you maintain your balance and vestibular function. So walking with head turns side to side as well as up and down Next. So these are the ankle sways, like you lean forwards and back and then go in a circle. Next. These are the yogasans, which people with better balance would practice for a higher level of balance. So then this is the eagle pose, tree pose, chair pose, and the warrior pose. So these are just some of them. There are multiple exercises in yoga you could do, and it's a wealth of exercise. Hazards in the home. So we did mention that there are multiple hazards in our own homes, and most of the falls happen in the home. So these are the things you should constantly be vigilant about for yourself and for your parents or any older adult in the home. So uneven floors, cluttered path, use or buckled carpeting. So that's never good. When a person is walking, if there are like different kinds of floors in your house, like there is wood floor transitioning to ceramic tile, transitioning to carpet or vinyl floor, every time you change a surface, an older adult can trip and fall. So if it is always best to have the same kind of floor throughout the house, if there are like variations in the floor, then it's a fall hazard. Deep pile carpeting, if the carpet is too deep, then that could lead to tripping. Area rugs are absolute no. Poor lighting, so night light that turn on with motion are recommended. Poor fitting footwear, we talked about that. Never wear slip-on slippers in the home. Always wear slippers that has a fit around the ankle and the heel. Because when you wear slip-on slippers, like the kind they have available here, you end up shuffling your feet, and shuffling could definitely cause tripping. Slippery and wet floor, unsafe bathrooms, and pets, as well as toys, children's toys. Next slide. So how do you improve safety of the house? So for bathroom, you have grab bars for the tub and the toilet. You have slip-resistant mats. You have to actually make an effort to assess your toilet and assess your bathroom and your home to put these simple interventions in place. Raise toilet seats, because our standard seats are usually low for older adults. Nowadays, you also get the handicapped toilets, which are taller. Shower chairs, transfer tub bench, handheld showers. Next. Then to improve the safety of transfers from the bed. So there are simple devices called the bed cane, which is available. If at night walking to the bathroom is not possible for the person, then provide them with a bedside commode that can be utilized at night. To improve walking safety, make sure you clearly mark the edges of the steps, because it could cause tripping due to poor vision, poor lighting, and then sometimes not being able to lift the foot high enough because they don't see the edge of the step. Handrail on both sides. Remove the door thresholds, and then proper skid-proof shoes and slippers. If your shoes are too grippy, that is also not good, because on a carpet that can cause you to trip. Remove or secure loose area rugs or tape them down with double-sided tape, and then clear clutter from the floor like rugs, toys, wires, and cords. For general home safety, make sure the things you need are at the counter or the waist level, so you're not reaching high, and you are not also have to be climbing on step stools, because a lot of falls happen because women, they climb up on step stools and then they are trying to reach the shelves at a higher level. Appropriate lighting, easy access switches, have a phone near the bed so you don't have to run to the phone. night lights, and this is a good thing to look into, which is called the PERS device, which is a personal emergency response system. And then it comes with a bracelet with a help button, or a necklace with a help button, and then they also put a button on the wall near the bed and in the bathroom. So if a person falls, they can summon help. This is the grab bar that you can install in toilet or the bathroom. This is a toilet safety rail to help them get up easily. Next. So this is a raised toilet seat that can just snap on. Always make sure if you are buying this, never buy the 4-inch, buy only the 2-inch. Because if you get the 4-inch, your feet will be off the floor. Then the shower chair has to always go with a handheld shower. And this is a transfer bench. So here they don't have to step into the tub. They can just sit first and then swing the feet over. This is a bedside commode. It's called a 3-in-1 commode. The frame can go on the top of a standard toilet, but also it can be used with the bucket next to the bed. And that is the bed cane. So it is a transfer safety handle for the bed for people to rise up from the bed. So to conclude, what do you really need to do to prevent falls? Participate in regular physical activity, remove hazards in your home, review your medications regularly, make sure your vision and hearing are checked once a year, and get your family member to assist you in your quest to prevent falls and make your life safer. And then you can always get a physical therapy evaluation to get a baseline as to where you are. And then based on that, you can target your interventions in certain areas. Thank you very much. And that brings us to the end of the slides.
Okay,
So
thank you
we
so
can have
much.
questions.
Yeah, thank you so much, doctor. I think कोणाला जर प्रश्न असतील तर please you can raise your hand or unmute and ask at this time. So yeah, so recording आम्ही नक्की पाठवणार आहे ह्याचं once it's available. I know that is one of the questions.
Thank you very much. This was a great presentation. It answered many of our questions. I thank Dr. Karambelkar and I thank the organizers. Thank you very much. Bye-bye.
Thank you.
Dr. Karambelkar, I have a question.
Yeah.
So typically we have annual physical for in America. Similarly, is there any test or anything for to prevent or check our physical therapy for annual physical therapy?
Yeah, so the doctors usually do not think of suggesting that, but it would be good if they suggest that. But there are people who come voluntarily to us. They ask their doctor to give them a script for balance evaluation or fall prevention evaluation or general conditioning and strengthening. Like I can give you an example. We have a patient right now. She's 88 years old and she lives alone and she still works 20 hours a week. She walks with a walker. She has very poor endurance. She's able to drive. She drives to work. And then she says, that's my only social connection. So I need to continue working. Her work is social work. So it is not very taxing. So she does that. And then she came to us and says that I do not want to fall. I want to continue to be walking safely and I want to get stronger. So then I can do things the same way that I'm doing or even better. So she came herself for fall prevention interventions. She was telling us that she feels very lonely right now because all her friends gradually have passed away. And then what she noted, she's a very educated lady. What she said that they were all doing fine until they fell. And I don't want to fall. She says, like, the simplest of things are so difficult for me. Like, if I have to go and eat at a restaurant, I have to think about, like, are there steps there? How do I get in with the walker? Will there be enough space? Will I be able to sit all the way down in that chair? Will I be able to get out of the restaurant chair? So all of these things. So people do that, like they come on their own. One patient came to us and she said that I want to improve my balance. You won't believe it. She came to us with her home health aide, like she had hired help to just bring her to us and then take her back. She was 94. She says that she was Arab, like Middle Eastern. So she said that I want to improve my balance because I used to be a badminton player and I have been very independent. I live by myself. And I want to be, when my friends visit or when my family visits, I want to be able to carry a tray of coffee to my guests. And I have difficulty doing that now. So I want to be able to learn how to do that again. So people, they have certain goals for themselves, and then to pursue those goals, they request their doctors to send them for therapy.
So my follow-up is, at what age should we ask for the referral?
So you are the best judge. Like, if you feel that, okay, there have been some difficulties in pursuing certain sports or certain things that you are currently doing, and it is not going the way that you wanted, and then if you saw some decline in terms of strength or balance or any symptom, then that's a good point to start.
Sure. Thank you, Dr. Karambelkar.
चॅटवर बरेच प्रश्न येत आहेत. सो जस्ट फॉर एव्हरीवन, हो स्लाइड्स आणि रेकॉर्डिंग आम्ही पाठवणार आहे हे झाल्यानंतर, सो यू डोंट हॅव टू वरी अबाउट दॅट. डॉक्टर, अजून एक प्रश्न आहे, इज फॉल प्रिव्हेन्शन प्रोग्राम इन्क्लुडेड इन द हेल्थ इन्शुरन्स?
Yeah, you can do that. Means see, when you request for fall prevention, you will already have some kind of condition going on. You might have osteoarthritis of the knee, or you might have occasional back pain or knee pain or difficulty in walking. So all we need is like a diagnosis, and it has to be only a musculoskeletal diagnosis. So that's all it's needed, and a doctor's order. So you can tell the doctor, oh, I have a knee arthritis and I want to make sure that I walk well and better, and then I don't lose strength in my legs. So they will send, sometimes they just send for physical therapy evaluation. That's all they write. And that's enough, because when we assess, we are able to find musculoskeletal difficulties that the person has, and that goes in the diagnosis field, and then Medicare does pay for it.
So, okay, so there was a follow-up on Medicare. So Medicare does pay for it, right? So you don't, it's covered.
The question from Vijaya, do you need referral for physical EVA and does Medicare pay? So to reiterate, आता जे डॉक्टर म्हणाले, because even I had that question, की referral असेल तर Medicare will pay, असं आहे का?
नाही. But it is, for the completeness of the chart, we need a script from the doctor. If they audit a chart, then we need a script that says physical therapy evaluation. That's all. And then it is not technically a referral, because some of the insurances, they say that, oh, we don't need a referral. You don't need a referral. So this is just a script. It's a MD order. And then even if you don't have one, it doesn't matter, because I have direct access. I have direct access to practice physical therapy. So if somebody comes to me and then I can see them for like 60 days without a referral or a script. And then what we do after we do the initial evaluation, we send a copy of that evaluation to the physician. And then we ask them to sign the plan of care and send it back. So once we have signed plan of care, that becomes the script.
Okay. I think Priya, तुम्हाला एक प्रश्न आहे ना, you've raised your hand.
हो, मला ते एक्सक्यूज मी ते बॅथ सीट तुम्ही दाखवली त्याच्यामध्ये 2 इंचेस and 4 इंचेस तुम्ही जे सांगितलं त्याच्याबद्दल थोडं माहिती सांगता का? मला थोडं ते कन्फ्युजिंग झालं. 4 इंचेस काय आणि
Yeah,
व्हॉट इज
that's
इट?
the height. That's the height of the seat. So if you look for it, then there may be more seats available at 4 inches, because previously the toilets used to be really low, older toilets, but now they are slightly taller. So if you get a 4-inch seat, it is very, very tall for the toilet. And then if you sit on it, the feet of the person can go off the floor. And then that's not good. Your feet should stay on the floor. So the one I showed you is called the Savannah raised toilet seat, and it is 2 inches in height.
Okay,
Savannah.
so
It's
actually
say
height
the
of the seat is what you're saying.
height of the seat.
Right. Okay, okay. Thank you. That's all.
अजून एक प्रश्न आहे अलका धर्माधिकारी. कॅन इव्हॅल्युएशन बी डन ॲट एनी फिजिकल थेरपी लोकेशन?
Yes.
येस. ओके.
मला एक क्वेश्चन आहे डॉक्टर, अँड दिस इज थिंकिंग अबाउट द फ्युचर. सो हे फॉल वगैरे नंतर होतात, पण फॉल कधी होऊ शकतात? सॉरी, आय सेड इट रॉंग. कधी होऊ शकतात, पण पडायच्या आधी व्हॉट कॅन आय डू? म्हणजे डज द कॅल्शियम इन माय बॉडी और माय बोन स्ट्रेंथ इम्पॅक्ट? सो व्हॉट इज द राईट एज टू स्टार्ट दॅट कॅल्शियम सप्लिमेंट? अँड ऑन अन ॲव्हरेज 45+ अडल्ट्सने किती घ्यावं कॅल्शियम?
Achha. So basically, you want to make sure that the calcium, whatever amount you take and whatever you get in the food, should be bioavailable. So you have to find the best bioavailable combination, and it has to be taken with vitamin K along with. So calcium and K together. And then you can start at any age. You just don't want to take excess of calcium. And then it is also a good idea to take vitamin D with the K supplement in it. So then it helps absorbing that calcium into your system more effectively. So you don't need like a heavy calcium dose. You can still do the recommended daily allowance or slightly more than that, and then make sure you eat more of calcium rich foods now. And then you don't have the risk of developing stones like calculi. If you take excess calcium, then it is deposited somewhere in the body then.
Okay. So home care, home safety evaluation वर question आहे for people who cannot go to the clinic. Sangeeta?
Oh, for the home safety evaluation, yeah.
त्याच्याबद्दल माहिती.
So that can be done like a visit or two at the most. And then all we do is we can basically select the place of service as home rather than clinic.
पण हे कुठलेही फिजिओथेरपिस्ट करतात का? त्याच्यात सुद्धा काही
आमच्याकडे म्हणजे तशी अवेलेबिलिटी पाहिजे.
अच्छा.
Because under Part B Medicare, outpatient physical therapy is covered. Outpatient physical therapy is in the clinic, but Part B outpatient therapy also covers visits to the home. So it is covered under Medicare. But for private insurances, we have to ask the insurance if they will cover a visit in the home. Medicare Part B, no problem.
ओके. प्रियाताई, तुम्हाला अजून एक प्रश्न आहे का आधीचाच हात आहे?
नाही, सॉरी, आधीचाच हात आहे.
नाही, हरकत नाही. जस्ट वॉन्टेड टू सी इफ यू हॅड अ फॉलो अप.
And for Madhavi, I could also add that the best thing for somebody in their 40s to do is weight training, resistance exercises. Very important. So then you will curtail a lot of risks anyway.
अजून काही प्रश्न आहेत का कोणाला? काही एनी अदर कॉमेंट्स, थॉट्स?
So what I will do is, like, along with the sharing of the information of the PowerPoint, I'll also share my email. So if anybody has to email me and ask a question, you can do that too.
Thank you so much. Yeah, आणि हे रेकॉर्डिंग अवेलेबल झालं की मी उत्तरांच्या ग्रुपवर टाकीन, सो एव्हरीबडी कॅन हॅव दॅट अलॉंग विथ द स्लाइड्स आणि डॉक्टरांचं कॉन्टॅक्ट ईमेल. सो काही नंतर आठवलं तुम्हाला किंवा फॉलोअप क्वेश्चन्स असतील तर यू कॅन डेफिनेटली रीच आउट. जर अजून काही प्रश्न नसतील तर आय थिंक दॅट्स इट फॉर दिस मॉर्निंग. थँक्यू सो मच सगळ्यांनी जॉईन केलं. आय थिंक ॲट वन पॉइंट आपल्या कॉलवर 42 लोक होती. सो वी डेफिनेटली हॅड अबाउट 35 or so उत्तरंग attendees. So really nice start to the year, to the first program. Thank you so much, Dr. Vibhakar.
Thank you.
I personally found it really useful. Looks like a lot of people got a lot out of it. So thank you very much. Thanks, Sangeeta, for driving the slides, and everyone else for joining. Have a nice weekend.
Thank you, Preeti.
Thank you, everyone.
Thank you very
Thank
much.
you.
Yeah, excellent. Bye.
Thank you. It was
Thank you.
excellent.
Very
you.
informative. Thank you.
Thank you. Thank you, Preeti.
Thank you.
Thank you.